Good afternoon, everyone, and welcome. I'm Steve Zinowitz, President and Chief Executive Officer at St. Barnabas Medical Center, and we have a very thoughtful and timely discussion today on how do we make sense of civil unrest during our COVID-19 crisis. I want to thank everybody for being on the call today, especially thank Dr. Denise Rodgers, the Vice Chancellor for Interprofessional Programs at Rutgers, Biomedical and Health Sciences. And at this point, I'd like to introduce Margie Heller. Margie is our Vice President of Community Health and Global Strategic Partnerships. And together they will review the program with you. And once again, thank you. We appreciate your time and attention and participation today.
Steve, appreciate that. So I am so excited and honored to have Dr. Denise Rodgers here today. I've had the privilege of getting to know Dr. Rodgers as she sits on our Corporate Advisory Council for Social Impact and Community Investment. As Micheline Davis recently said, for those of you who feel uncertain in the space, we want to provide resources for you to better understand how you can help by being an ally. By better understanding what your coworkers, neighbors, and friends are going through and how not to mention it further traumatizes. It is a sign of strength to research what you may not fully understand, may not fully agree with, or what you haven't experienced. To be part of the solution is to be actively engaged in being a change agent by speaking with your family, your children, loved ones, friends, colleagues, and neighbors. Using this as a teachable moment, we all will begin to heal and work toward creating a better, brighter, more equitable future. On behalf of Micheline Davis, myself, and the SICI practice, Denise, I want to thank you for being here today. I can go on and on about Dr. Rodgers' accomplishments. She is Vice Chancellor for Interprofessional Programs at Rutgers Biomedical and Health Sciences, and is the Chair in Interprofessional Education at Rutgers Robert Wood Johnson Medical School, where she is professor in the Department of Family Medicine and Community Health. Dr. Rodgers has spent much of her career working with poor, minority, and disadvantaged patients and communities. She currently chairs the steering committee for Believe in a Healthy Network Culture of Health initiative that was funded by Robert Wood Johnson Foundation and New Jersey Health Initiatives. She chairs the board of directors for the Greater Newark Regional Population Health Hub and is vice chair of the board of the Greater Newark Healthcare Coalition. Dr. Rodgers received a Bachelor of Arts in Psychobiology from Oberlin College and graduated from Michigan State University College of Human Medicine. She completed her family medicine training in the residency program in social medicine at Montefiore Medical Center in the Bronx. Dr. Rodgers is board certified in family medicine and is a diplomat of the American Academy of Family Physicians. Before I turn it over to Dr. Rodgers, I ask that you ask your questions through the chat function, and we will try to get to as many questions as we can at the end of the program. And now I turn it over to my good friend, Dr. Denise Rodgers. Thank you.
Thanks, Margie, and thanks so much to the leadership of St. Barnabas Medical Center for inviting me to come and address this very important issue today. So let's start with my slides. So as has been advertised, I'm going to talk about how do we make sense of civil unrest during COVID-19. However, it would be inappropriate for me to talk about civil unrest before acknowledging what so many of you and us have been living through these many months, without talking about the significant impact that COVID-19 has had on our work lives and our lives in general. I want to first talk about the fact that during the height of this pandemic this spring, we were faced with insufficient PPE and concern about running out of ventilators. We raised the question of how did we come up so short of PPE. Despite years of warnings that this type of pandemic was possible in this country, we found ourselves ill-prepared for what has come to pass. And that sense of us being ill-prepared leaves us with a feeling that those in charge have failed us. We know that many of you have, in the beginning at least of this pandemic, faced shortages of PPE. And we know that the entire experience of caring for so many patients with COVID-19 has, for many, presented significant challenges in how to maintain your mental health. Related to that, many of you are experiencing anger at the failings of governmental leaders to make sure we were adequately prepared. For many of us, there's significant fear. Are we going to get COVID-19? Are we going to take it home to our families? And for many as well, there is profound sadness at the amount of death that we saw. And quite frankly, so tragically, the number of people who were forced to die alone without their family members. We also know that that fear of getting infected with COVID-19 is a real one, as nearly 600 healthcare workers have died from COVID-19. These are the faces of some of the healthcare professionals who have died in this country from COVID-19. Part of the reason I show these faces is to say that even amongst healthcare workers, COVID-19 disproportionately kills people of color in the healthcare workforce. In addition to adversely impacting healthcare workers of color, COVID-19 also adversely impacts African Americans in this country at disproportionately high rates. And I show you here many of the headlines that we've been reading day in and day out about the impact of COVID-19 on African Americans throughout this country. And so what we see here is the data from New York City. Data that tells us that African Americans in New York City are more likely to be infected with COVID-19, they're more likely to be hospitalized from COVID-19, and they're more likely to die from COVID-19 when compared with their Latino, white, and Asian counterparts in New York. While African Americans make up 13% of the population of this country, they make up 23% of deaths from COVID-19. This article I bring up because it also talks about the reality that social conditions, structural racism, and other factors contribute to these increased deaths in the African American community from COVID-19. This slide is the CDC data that actually demonstrates that 13% of the population, 23% of deaths information, and I show it here so that you can quickly see the data for other race ethnic groups in this country as well. So now we move to New Jersey. And what this graph, thanks to the folks at NJ Spotlight, shows us, that is, if we look at the yellow line, we see the percent of the population of the state of New Jersey. If we look at the red line, we see the percentage of deaths, and if we look at the green line, we see the percent of cases. And it is only for African Americans in the state of New Jersey that the red line, the number of deaths, exceeds the percent of the population. So the disparity that we see throughout the country, we also experience here in New Jersey. But that's not the only disparity, COVID-19, in health outcomes here in New Jersey. The average life expectancy for African Americans in New Jersey is about 3 years less than the average life expectancy for whites and about 15 years less than the average life expectancy for Asians, who indeed have the highest life expectancy in the state of New Jersey. The average overall age-adjusted death rate for African Americans in New Jersey is higher than that for other groups. I'm going to briefly translate this slide for you because there will be a series of slides similar to this. And the main thing to pay attention to is that the blue line represents data for whites, the yellow line is for African Americans, the orange line is for Hispanics, and the purple line is for Asians. Again, this is not about memorizing the exact numbers, but more getting the sense of proportionality. So in addition to having an overall age-adjusted higher death rate in New Jersey, African Americans die at higher rates from heart disease, die at higher rates from cancer, from stroke, from hypertension, from diabetes, from influenza and pneumonia, at significantly higher rates from asthma, significantly higher rates of death in African Americans from HIV/AIDS. African Americans are more likely to die from car accidents, and African Americans are significantly 13 times more likely to die from homicide than their white counterparts in the state of New Jersey. And much of what we see in New Jersey is similar to the data that we see throughout the rest of the country. It is no surprise as well, African American women are significantly more likely to die due to maternal complications after birth. An African American infant is 2 to 3.5 times more likely to die in the first year of life in the state of New Jersey when compared to their white counterparts. And after these children are born, nearly 1 in 4, over 1 in 4 African American and Latino children in the state of New Jersey are likely to live in poverty compared to fewer than 1 in 10 white children who live in poverty. When we think about life in America, I often think about it like a Monopoly game. However, 400 years of racism, of slavery, of Jim Crow, of continued discrimination means that while whites get to start the Monopoly game at 2 o'clock, African Americans are not allowed to start the game until 3 o'clock. When African Americans start the Monopoly game, they start with $15 compared to $1,500 that whites start with. African Americans are significantly more likely to get the go directly to jail card, while whites are significantly more likely to get the get out of jail free card, despite similar rates in many types of crime in this country. And what you will also see is the red line covering Park Place and Broadway, because African Americans are not even allowed to go visit those streets, let alone able to buy property and live there. And what is the impact of that? Broadway and Park Place are places where the mortgage value is $175 to $200, where rents can go as high as $2,000. African Americans, on the other hand, are forced to live in Baltic Avenue and Mediterranean Avenue, where the mortgage value is $30 and the highest rent is $250 for Mediterranean Avenue and $450 for Baltic Avenue. And if we move beyond monopoly to real life, what we see is that the median net worth of white households in the United States is $171,000 compared to $17,000 for African Americans. If we look at income, we see that the median household income for whites is $71,000 compared to $41,000 for African Americans in the United States. If we look at unemployment, we see that African Americans are more likely to be unemployed than are their white counterparts. And this is data since the impact of COVID has begun to be felt in this country. We see that African Americans are significantly more likely to live in poverty than are their white counterparts. African Americans are more likely to be uninsured than their white counterparts. And recently, we have data that suggests to us that not only is the disease of COVID-19 itself having a disproportionate adverse effect on African Americans, but so are the economic consequences that have been associated with this crisis. So what we know is that Black and Hispanic workers are more likely than white workers to be paid in jobs that are paid by the hour. They are more likely to be laid off, and they are more likely to be the least rehired. This report from JP Morgan Chase gives us further financial data that helps us to understand the potential for an even greater adverse impact on African American communities due to COVID. So what this slide shows us is that for every dollar of liquid assets that whites have in a range of age groups, African Americans overall have 32 cents, and Latinos have 47 cents. And as we can see throughout all age ranges, there is disparity in liquid assets by race ethnicity in this country. What we also see in this slide is if we look at liquid assets by race and gender, we see that for every dollar a white man earns, a white woman earns 74 cents. And for every dollar a white man earns, a Black man earns 29 cents, and a Black woman earns 26 cents. For every dollar that a white woman earns, a Hispanic woman earns 51 cents, and a Black woman earns 36 cents. These are the realities of the economic disparities that exist in this country today. And as you can see from this headline, there are more and more predictions about the rise of poverty related to COVID-19. And this is the report from which that headline was taken. And what this report suggests to us is if unemployment in this country goes to 30%, 1/3 of African Americans will live in poverty. 29% of Latinos will live in poverty. And shamefully, 21% of children will live in poverty in this country. And as was shown in my earlier slide, a disproportionate impact on children of color will be felt if we indeed get to 30% unemployment in the United States. There is talk of a Black depression, and here we're talking about an economic depression if the impact of COVID-19 is felt. Remember, during this most recent recession that happened less than a decade ago, Black unemployment topped 16% when overall unemployment was 9%. So we may wonder why. How did we get here? Well, part of the way we got here is that a significant contributor to assets, in addition to earned income, actually has to do with housing value. And we know that there has been a systemic movement in this country for decades to perpetuate segregated housing, to work to reduce the kinds of loans that African Americans have been eligible to get. That combined with steering by real estate agents that contributed to white flight. And what we have then is concentrated Black inner city poverty. This is the legacy of life in America. And what a report from Newsday showed us last year is this legacy hasn't changed all that much. So a 3-year investigation by Newsday looked at the practices of realtors on Long Island and found that in 19% of instances, Asians were discriminated against in housing. In 39% of instances, Hispanics were discriminated against, and half the time, African Americans were discriminated against in housing. And let me remind you, I'm talking about 2019, not 1919. We have evidence from this article from The Lancet that talks about the adverse health impacts of structural racism, and we begin to understand that residential segregation is associated with adverse birth outcomes, increased exposure to air pollutants, decreased longevity, increased risk of chronic disease, and increased rates of homicide and other crimes. We also know that discrimination in hiring continues to exist from this reporting that came from 2017. This report concluded that white applicants receive 36% more callbacks than equally qualified African Americans, while white applicants receive on average 24% more callbacks than Latinos. The myth of progress helps obscure the truth that in America today, African Americans are still marching for civil rights. James Baldwin said, "What is it you want me to reconcile myself to? I was born here almost 60 years ago. I'm not going to live another 60 years. You always told me it takes time. It's taken my father's time, my mother's time, my uncle's time, my brother's and my sister's time, my nieces and my nephew's time. How much time do you want for your progress?" I think of racism as shorthand for prejudice plus power. My friend and colleague Kamara Jones says it more eloquently as she says that racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks. It unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole of society through the waste of human resources. We must note that after the Emancipation Proclamation, African Americans were disproportionately arrested for minor crimes so that they could be imprisoned to continue providing slave labor for white owners. This is the history of America. This is the history that we still struggle to overcome today. This is Charlottesville, Virginia. And this is Dylan Roof, who killed 9 African Americans as they worshiped in a church in Columbia, South Carolina. We have a long history of silent, quiet protest. Only today, only now, after recent events, is there acknowledgement that perhaps it was appropriate for Colin Kaepernick to take a knee in protest to police brutality before football games. So how did we get to this present moment? We must be reminded that Christian Cooper, an African-American Harvard-educated bird watcher, has racism used against him by a white woman in Central Park when his only offense was to ask her to leash her dog. We must be reminded that Ahmaud Arbery was murdered as he chose to jog in the wrong neighborhood. Breonna Taylor was murdered in her home by the police as they looked for a suspect who had already been arrested by the time they went to her home. And of course, we must remember George Floyd, who was so callously killed by the Minneapolis police for the crime of perhaps attempting to use a counterfeit $20 bill. I will not show you again that picture. It is a horrendous picture for all of us to look at as we realize that for nearly 9 minutes, A man put his knee to another man's neck, lost complete sight of his humanity, as this giant of an African American man laid on the ground saying, "I can't breathe," and calling out for his mother. This is the man who did this. But these are the men who were complicit in allowing him to do this. And we must understand the complexities of American culture, as one of those police officers is a Black man as well. And none of these men did anything to stop the murder of George Floyd. And so when we talk about anger and fear and sadness, it is important to understand that as African Americans, we are angry. We are angry about 400 years of oppression and discrimination that continue until today. We are fearful for our lives on a day-to-day basis. I personally have enormous fear of the thought of my 22-year-old daughter being stopped by the police, worried about what they will do and how they will treat her. And I am filled with profound sadness over the death of so many innocent African Americans, and quite frankly, about the death of so many African Americans from preventable causes. So that is why there are demonstrations and protests in the course of a COVID-19 pandemic. We were pleased to have a very peaceful and important demonstration in Newark on May 30th. And yet we recognize that at times, peaceful protests do become violent because a very small minority of people become overwhelmed with their rage and act out in ways that are not necessarily productive for society as a whole, but serve as a demonstration and a reminder of the levels of inequity endured in America. And we must also recognize that while there's a lot of discussion about people seeing the light and people being more understanding of the problem of police brutality, there are others who still maintain their racist ways. This is a picture of a counter-protester on Monday, this Monday, in Franklinville, New Jersey, as he and his friend reenacted the killing of George Floyd. I can't even begin to understand why. And what do we discover? We discover that one of these men is an employee of the New Jersey Department of Corrections, a Department of Corrections that by and large is filled with prisoners who are Black and brown, and imagine how they are treated by that man doing his job. Maya Angelou reminds us that the plague of racism is insidious, entering into our minds as smoothly and quietly and invisibly as floating airborne microbes enter into our bodies to find lifelong purchase in our bloodstream. Racism is indeed like a disease that we must all work to cure in this country. And so I end with this picture of those young demonstrators in Franklinville, New Jersey, who were willing to go to the streets and declare Black lives do matter, and it is important that we eliminate discrimination and racism in the United States for once and for all. Thank you.